Oh, I like this one. Barb chiming in. Please discuss dentures, partials for those who have lost many teeth. What should dentures be made out of? And should the teeth be plastic or porcelain? Are there gluten-free, non-toxic dentures? You know, this is one of those, if you require dentures, you need them to chew your food to maintain your nutrition. So it's really about picking the least toxic option that you can have. Now, one of the things that you can do, one of the things you can ask your dentist to do is ask your dentist to do what's called oral compatibility testing. What does that mean, oral compatibility? Before they put something in your mouth, let me spell that right for you. Oral compatibility testing, I really mangled that, is testing you to see which kinds of materials that he's going to use that would potentially work against you or that your body would react to. And a lot of dentists do this, and especially if you, when you're going to a dentist, try to find a dentist that has been certified through IAOMT. These dentists are more natural. They're what are called biological dentists. They're going to have it's almost like functional medicine versus traditional medicine. These are the functional medicine dentists. They're interested in things like oral compatibility. They're interested in using less toxic materials in your mouth because they know that putting the wrong material in your mouth could lead to an unsuccessful outcome for you. So doing oral compatibility testing first before you make the decision of what you're going to choose to use, because I've seen cases where people were allergic to some of the dental ingredients that they had placed in their mouth, and it was creating a lot more problems. So oral compatibility testing is the first thing. Some, you have to be careful whether or not they have gluten. So the other thing that you always want to make sure that you do is anytime you put any type of device in your mouth from and this is whether it's surgery in your mouth from a dentist, there's something called a materials data sheet, and you can request this materials data sheet. Anytime you're putting something in your mouth, the manufacturer has, what is that made out of? What are the cements and the glues made out of? Do they have gluten? There was a study a couple of years ago on a child with celiac disease, had not dentures, but had braces put in, and the adhesion in the braces had gluten in it. And so the child was reacting very seriously to the braces themselves. So always get a material data sheet from your dentist to make sure you're not putting affixing something into your mouth with a gluten-based adhesive that could potentially create problems for you. The connection between bleeding gums despite perfect hygiene and ulcerative colitis flare. Well, I mean, bleeding gums are inflamed gums, and colitis is an inflamed colon. And so if you're doing things, if you're eating foods or you're being exposed to things orally that are creating inflammation, it can affect not just your colon, but it can also affect your mouth and your gums. So even with perfect hygiene. So I would think there in that situation, I would either think what medicines that could be contributing to that problem, or I'd be thinking what foods or chemical exposures might be contributing to that problem. Let's see, do I think that gluten should be avoided in individuals that do not have chronic illness and also test negative? Not necessarily. Again, that goes into, should we avoid gluten if we're not gluten sensitive and we're healthy? Maybe not. Now, some people would argue that. I would say if you have a really strong, robust, healthy digestive tract, you should be able to tolerate gluten if you're not gluten sensitive. But that being said, you then have to start evaluating the quality of where that gluten is coming from. Is it organic? Is it sprayed with pesticides? Is it a GMO type of grain? Like, these are all questions that you have to ask beyond the gluten element that play a role in how healthy one of these food items might or might not be. This is a good question. I understand that wild rice is grain-free. Was wondering why the bag of wild rice says whole grain. It shouldn't. That's just the ignorance of the manufacturer of that product. On that note alone, I probably wouldn't buy that product from that company because they don't take enough time to even understand what they're putting on their own label. But it shouldn't say that because it isn't a whole grain. Can someone only be sensitive to alpha gluten only, leaving them okay to eat other forms of gluten if it's organic? No, I haven't seen that be the case. So no, don't. If you're gluten sensitive, don't just avoid alpha gluten, avoid all forms of gluten. So Claudia says, I get cold sores every other 2 months or so, and I didn't know why. I even eat gluten-free only. Well, I would consider, Claudia, if you're eating the traditional, if you don't know the difference between traditional gluten-free and a true gluten-free diet, you might want to consider how gluten-free you actually are. Go to glutenfreesociety.org and sign up for our newsletter there, and we'll send you an information packed on the differences between the types of gluten-free diets that people follow, because you may be getting gluten, you just don't know it because you don't have the full understanding of what gluten is. And then there are other things as well that can cause that problem. So cold sores are not explicitly solely caused by gluten. There certainly are other things, but gluten is definitely one that you want to look into. Let's see here. I love that. Thanks, Donna. Donna says, hello from Florida. Thank you for all you do for us. The master class was awesome. Thank you, Donna. So glad you enjoyed it. Glad it was helpful for you. Is the sweetener Dolcetti, which contains organic apple juice concentrate, safe to use as a natural sweetener? It has a glycemic index of between 2.5. Now, I haven't really looked at that one, Mary. I would say look at all the ingredients, and depending on what other ingredients it might have, you might consider it as safe or not safe, depending on what other ingredients it might have in it. I personally don't like any kind of juice from concentrate. I think concentrating sugar is probably not a great idea, especially since tonight we're talking about the oral health. Concentrated sugar in the mouth equals concentrated cavities and deterioration of the oral health. Let's see, Margie. My gums hurt often. My dentist wants me to use fluoride, non-whitening, non-plaque removing toothpaste, but I refuse. I use Jason fluoride-free toothpaste. No gum disease. So I didn't see the question in that, Margie. Maybe that's just more of a comment. How does burning mouth fit in with food sensitivities and leaky gut? So burning mouth can be, Dan, it can be a number of different things. I've seen burning mouth be associated with B vitamin deficiency. I've also seen it be associated with mold or metal toxicity. And so if we're talking about mouth, one of the metals is mercury. Mercury toxicity, especially if you've got old amalgams that are silver-based amalgams leaching mercury, that's something that we'll sometimes see associated with that problem. But mold in your environment can also create that burning mouth or that burning tongue issue as well. Does oil pulling help keep the mouth bacteria down? I'm not a big fan of oil pulling. People that do it every day, I think it's a bad idea. Coconut oil, using heavy amounts of coconut oil on a daily basis. Remember, coconut oil is a natural antibiotic too. And so just like we want to avoid the massive use of antibiotics when it's unnecessary, pulling with coconut oil every day, in my opinion, is not the greatest of ideas. If you did it here or there or occasionally, especially if you had like a problem you were trying to address with it, then you might try to use it. But I just don't recommend it on a regular daily basis. Could gluten have caused parotid and submandibular gland pleomorphic tumors? I had to have both glands on the left side removed. I'm now on grain-free, dairy-free diet, but I've lost most of my teeth. You know, Cheryl, there are studies that show gluten can cause oral cancers or mouth cancers. I've not seen anything specific to those tissues or to that type of tumor as it relates to gluten in the medical literature, but that doesn't, you know, again, it's hard for me to give you an answer because I'm not familiar with anything, or I'm not aware of any research or studies that have been done in relationship to that. So I think if it did cause yours, it would be purely anecdotal. We would be saying purely anecdotal in that regard. Does health insurance pay for genetic testing for gluten sensitivity? Depends on your insurance carrier, depends on your doctor's knowledge of which genes to actually look at and which genetic alleles to actually look at. It possibly could, but again, without interpretation, you may be getting the test without interpretation, which wouldn't be a whole lot useful for you. But again, that's just what your insurance covers is between you and your insurance company and between the doctor making the claim of medical necessity, meaning you have a medical necessity to order that test and have your insurance cover it. Lots of tonsillectomies in the room tonight. Oh, I like this. So, dentist traumatized a molar years ago and it died. I've suffered flare-ups over the years. The doc wants to extract the tooth, but it's quiet since going gluten-free. Can I keep this tooth if I stay gluten-free? You know, I'm not a dentist, and I don't have the benefit of actually doing an oral examination on the mouth for you and being able to help you make that determination. You know, you might get a second opinion. If one of your dentists wants you to pull it, you might get a second opinion with the doctor. Go to iaumt.org and see if you can find a doctor who's certified biological dentistry and who's in your area. That might be kind of a better way to go about it, is just get a second opinion. Because again, the problem with the dead tooth in the mouth could be that might be a hotbed for a future infection or a hotbed for decay. If the tooth is truly dead. And that's where you just want to get a qualified dentist to be able to render you a good opinion so that you don't end up in trouble. Let's see. So I like this. Sarah says, since I went off dairy and eggs, take your calcium and magnesium, my teeth are actually getting whiter. Oh, where'd it go? They were always on the yellow side since I was a kid. Grain-free since July 2019. Thanks for that testament, Sarah, to the power of diet change and supplementation. So, again, maybe some of you have been asking about yellowing of teeth as a potential. Well, Sarah's testimonial there is a pretty good place to start. Diet change. Root cause of a fissured tongue. You know, if you've got a fissured tongue, if you've had it since you were an infant, since you were a baby or you were born with it, it could have just been a birth defect in the womb. So it's hard to know. There definitely could have been something in the development during gestation that occurred that led to that. Just like cleft palates and other forms of neural tube defects. Jackie's asking about ozone cleaning or ozone treatment at the dentist's office to flush after cleaning. I think if that's what your dentist is recommending, it's probably not a bad idea. Ozone can be a very potent agent to flush out, especially if he's trying to flush out any type of infectious decay or debris. Mark's asking, I had a root canal 25 years ago. Should I have it removed even though I have no health problems so far? Mark, what you can do, get with a good biological dentist, can ask for a cone beam x-ray. And what they can sometimes identify is an infection under the tooth. You can have them asymptomatically, but if you do that, that's going to give you a better idea. But again, I can't tell you whether or not you need to have it removed or not, but a good biological dentist doing a cone beam x-ray might be able to get you a better answer. Can celiac disease cause hair loss? Yes. We did a whole show on that once, Alex. Particularly alopecia of an autoimmune nature, it can create that because it from an autoimmune perspective can create an autoimmune response against the hair follicle, leading to patchy-like hair loss. Alopecia areata, alopecia universalis are two of the forms of autoimmune hair loss. But it can also lead to malnourishment, right? And malnourishment means low levels of protein, potentially low levels of nutrients that are necessary for hair growth and the health of your hair, which can lead to thinning of the hair and then diminished hair as well. Castor oil for oil pulling. Don't recommend it. What's the best way to test for food sensitivities? There's multiple ways, Jennifer. It's not one particular methodology, but there's 6 different methodologies that need to be looked at. IgE, IgA, IgM, IgG, immune complex, and T-cell response are the 6 different ways that we know of that the immune system can react to food. So it's a combination of those different things as far as being accurate and being thorough. A lot of doctors only measure something called IgG subtype 4, which is not the most accurate way to measure for food sensitivity. Can gluten cause high blood pressure? It can. Go back and watch our show on gluten and cardiovascular disease for more specifics on that. Yeah, so since cold sores are often blamed on a virus, can it still be a virus when you have HPV in your system? It can be, but I've seen a number of people with HPV, human papillomavirus, with cold sores as well. When they go gluten-free, they no longer have cold sores, but they still have HPV. So it's possible, but at the same time, gluten's a major factor in that. As a matter of fact, a colleague of mine did a study a number of years ago and found the #1 silent symptom of gluten sensitivity was the formation of frequent cold sores and aphthous ulcers. Okay, let's see here. What's the difference between making my own potatoes in olive oil baked in an oven versus potato chips in a bag? The biggest one, Jane, is the level of heat used to fry those chips that you're buying in a bag creates a process or creates a compound called acrylamide. Acrylamide is what happens when you overheat a carbohydrate, and it's a carcinogen. It's classified as a carcinogen. So those potato chips, a bad idea. Anytime you get something like a fried potato chip, not healthy. Even if it's organic, even if the oil they fried it in is organic, don't fool yourself. Fried potato chips are not good for you. That's not to say that you guys aren't going to probably eat them from time to time, but you shouldn't justify the daily use of that just because they're organic and cooked in organic oil. Jenny's asking, does that mean no nano silver mouthwash? Probably referring to what I said earlier about coconut oil being a natural antibiotic. You can still use a silver mouthwash. Its antibiotic activity is not super great, and you're not sitting it in the mouth. You're not, hopefully, if you're using it, you're not holding it in the mouth for 15 or 20 minutes. You're just rinsing out and spitting it out. So you're not going to get that longer base exposure that you would get when you're doing oil pulling directly. Nicole's asking me, do I eat potatoes or dairy? If I'm going to eat dairy, it's A2 milk. A2 from my own cows, because I'm just fortunate enough to live on a farm. I can do that. But your regular grocery store dairy, I wouldn't recommend that. It's typically A1 milk, which is known to mimic gluten and create problems. As far as potatoes, yes, I do eat potatoes, although not in overabundance. Where people get in trouble with potatoes, not that potatoes are bad for you. Actually, they're rich in potassium and many other minerals, rich in vitamin C. It's the quantity. It's the baked potato that they load up with sour cream and cheese and butter and bacon and all that other nonsense. So it's the fillings more than anything else. But yeah, when I sit down to eat some potatoes, it's usually a half a cup or less. So I'm not getting that carbohydrate load and certainly not smattering it in all kinds of processed dairy foods in that baked potato fashion. Good questions. My tongue is sensitive to acid like oranges, apples, and most fruits. Do you have any thoughts? I mean, yeah, you could have reactivity to those foods, and that might be part of why your tongue is sensitive to them. It may not have to do with the acids per se as much as it's the sensitivity is to actually the sugar in the actual fruit itself, creating kind of an excitement of bacteria within the oral cavity, creating a problem. So, for some people, Jackie, we actually put them on a really low carbohydrate diet for a little while and see if that's beneficial or helpful. And you might make that attempt and see if your tongue sensitivity doesn't improve. Next question, Marcus wants to know, what about sweet potato chips? Same thing, Marcus. Sweet potato chips fried in oil at high temperatures also produce acrylamide. So yeah, you got to be cautious and careful about that. Have I heard of teeth grinding as a sign of gluten sensitivity? Yes, Esther. That's called bruxism, bruxism, and it can be a sign of gluten sensitivity. It can also be a sign of malnourishment. Bruxism is commonly present in people that have calcium deficiency or oftentimes magnesium and sometimes even potassium. These three are super important for the maintenance of muscle tone. And so what happens is you get tightness in the masseter mandibular muscles, and you grind or you clench when you go to sleep at night. And this is not so much like a disease per se as it is an imbalance, an electrolyte imbalance. And again, why gluten can cause that is because gluten can deplete calcium, magnesium, and potassium and lead to that type of symptom. So yes, the grinding. So if you've been to a dentist and you told you need a mouth guard, you may need a mouth guard, but you may also just be deficient in some minerals and you need to get that corrected. So White Space Marine says, shouldn't I pay attention to my body and what it tells me? Doctors tell me high carb, low carb, etc. But when I cut out grains, I feel so much better, but I gain weight. So depends on the kind of weight that you gain. So, yeah, you should listen to your body. That's the first rule of nutrition, right? Well, it's actually the third rule of nutrition. There's 3 rules. You can't get healthy eating food that's not. Don't eat what you're sensitive, allergic, or intolerant to. And listen to your body is the third rule. But sometimes when you listen to your body, there's conflicting information. So like if you're not eating grain but you're gaining weight, the issue probably there is that you're eating too much calories overall, and probably in the form of fat, because a lot of people gravitate away from grain and they go more toward heavy base of nuts. And so again, it could just be a caloric excess that's creating for you. So it just depends. But yes, listening to your body is definitely a smart thing to do. Let's see. What whole house water system? So that's a good question. There's not like a particular brand, one brand over another for a whole house system. What you're really looking for, depending on your water. So think of your water filtration and your water system as what's your need. So like if you have well water, generally speaking, GAC, granular activated carbon, and KDF, and what's known as a 0.5 micron carbon block, these are great filters. And the reason why is you don't have fluoride and you don't have bromine. Whereas if you live in the city, you want all these things, but you also want reverse osmosis. Attached to that water filtration. Some people go for UV, so having their water run through UV light, ultraviolet light, that's not a bad idea because it helps to prevent the microorganisms from showing up into your water, especially again if you're in the city, that UV light. Remember, you're pulling. City water filtration is something that, in my opinion, over time has deteriorated and become more chemically dependent, and they use a lot more ground surface water, which has a lot more chemicals and pollutants that their filters can't pull. Remember, the job of city water filtration is really to make sure there's no microorganisms in the water that would cause an epidemic of disease spreading from the water contamination. Their job is not to pull out, the chemicals as well. And so that's where RO combined with this KDF right here can be some of the most effective. So looking at where you live, the best thing to do is call out a reputable company and have them test your water, get a water report from your area to see which strength of these different filters and which combinations would be best for you in particular. It's just like your health. There's not like a one size fits all in health. There's not like a one size fits all with water filtration either. Let's see here. Yeah, so a couple questions about about cleaning products. Castile soap is grain-free. that's probably one of your better options as far as like cleaning and you know, being in the shower. If you're talking about there's also soaps that are made from things like other natural oils like coconut that you can get as well that are grain free, as opposed to containing things like oat and wheat germ, etc. Let's see, scroll down on the left for me. What's my take on root canals? Like I've been faced with needing a root canal when I was a kid. I grew up pretty broke, and you know, by the time I was an adult and I had this impaction of wisdom teeth coming in the back of my mouth, they told me I needed a root canal. I opted to not do a root canal. I opted to remove the tooth and have an implant put in. And the reason why I opted that is because the root canals, that you run the risk of that dead material being in your mouth, running the risk of potential for a big time infection and other health problems. So again, that's my take on it. I would encourage you to talk to a dentist who's IAOMT certified. Those guys, in my opinion, are the sharpest of the sharp in the realm of dentistry. How can celiac affect your tongue? I think we kind of answered that already. We talked about earlier about glossitis, swollen tongue, and lesions on the tongue directly, all potential possibilities. Let's see here. Did I miss one? No. Go all the way down there. Okay, up to, sorry. Trying to find a good question here. There's a lot of off-topic questions. I don't want to get too far off topic here. What's the best toothpaste to buy? Depends on the person. I mean, there's a number of good brands. Kiss My Face, Jason is a good brand that most of you can find in a local grocer. But those are decent brands. Let's see, is exfoliative cheilitis a gluten sensitivity problem? It sure can be, Nia, so that's something you might want to look at. What are the signs of irritated tongue due to gluten sensitivity? I think I answered that a couple of times now. How can celiac affect your tongue? I answered that one as well. Is it okay to use hydrogen peroxide in a waterpik to keep bacteria down in the mouth? It is. Hydrogen peroxide is actually an ingredient in a number of toothpastes. It's a really benign ingredient. It's one of the best, really, in my opinion. It's actually one of the best ways to keep fungus down. So if you struggle with chronic mold or chronic mold issues, that's one of the best ways to get rid of it. A lot of people want to apply like oregano oils or thyme oils or other antimicrobial oils or antifungal oils, but I find hydrogen peroxide to be probably the most effective of everything when it comes to a fungal issue. Should you get your old fillings out, the ones with mercury? Lynn, that's a good question. It's not a yes or no answer. I think more than anything, some doctors would tell you yes. I'd more fall in line with, if it's not broke, don't fix it. If the amalgams are not emitting massive quantities of mercury and creating mercury poisoning, then getting them out, you run a risk of mercury poisoning. Even if you're using a biological dentist and they're damming you right and properly and using the right fans. But the best way to decide that, in my opinion, is to do mercury testing. So actually do what's called a pre and post provocation test to measure whether or not mercury is a problem. If it is, you need to get the amalgams out. Okay. Oh, we went too far, I think. Keep going. No, go down. How about organic, non-GMO popcorn? Thanks for asking the question, Sue. Just the nature of that question lets me know that you probably are new and you've got a lot of learning to do as it relates to what is a gluten-free diet, a true gluten-free diet. What I'm going to encourage you to do is go to glutenfreesociety.org and sign up for our newsletter, and I'll send you a bunch of free information about that. But to answer your question, since you're here tonight, no, organic non-GMO popcorn is not okay. if a person is gluten sensitive. It's a major train wreck of a problem waiting to happen. Is there a weight gainer supplement recommended for a 15-year-old boy with a tall, thin frame? You know, best weight gain supplement, probably creatine monohydrate. It's long safety track record. It's not going to do any damage, but it'll help that 15-year-old who's trying to do more weightlifting and working out, put on mass and strength more quickly. Other than that, protein, specifically amino acids broken down. So I have a product called Ultra Aminos that would fit that bill really well. Also something called Ultra Pure Protein that would fit that bill really well. Let's see here, keep going down. Severe irritation in the ears for several years. Doctors don't know what it is. Itching, stinging, flaking. One recommended a steroid cream. Could it be a reaction to gluten? It's possible. I mean, the only way you're going to know that is really go gluten-free. And if you're not willing to commit to that, then test to see if you're gluten sensitive, and then, you know, honor whatever you find. Is there a grain-free toothpaste? Yeah, there are lots of options for grain-free toothpaste. Again, I think I mentioned two brands earlier. Jason and Kiss My Face are two brands that you can get grain-free toothpaste from. Do you need vitamin K2 with your vitamin D? No, you don't, but you can take them together. There's a lot of, I'll just say there are a lot of internet folks chiming about how dangerous it is to take vitamin D without vitamin K2, and that's not true. That's mostly hype and mostly people who've read one or two studies that are not the end-all be-all. It's very fine to take vitamin D without vitamin K2. You can also take them together, and there's nothing wrong with that either. Okay. Man, we're already 10 over, aren't we? Wow, where did the night go? So, if I didn't get to your question, I apologize, but we're right on the time, and we got to check out. So, again, if you're new to the show and you're new to Pick Dr. Osborne's Brain, I come back every Monday at 6 p.m. We do a live Q&A. Come back and visit. And if you want to get notifications about the show, make sure you come subscribe. You can do that at glutenfreesociety.org. Subscribe to our newsletter. You can also do that on our YouTube channel. Just hit the subscribe and the bell, and you get notified when we go live. Again, we do a live show every Monday night, and I post 4 to 5 videos a week. So if you want to learn and get educated and do more to improve your health, come join us at youtube.com/glutenology. This is Dr. Osborne wishing you excellent health and wishing you an excellent week. We'll see you next Monday for another episode of Pick Dr. Osborne's Brain. Take care. Hey, if you've got a functional medicine or health question that you'd like me to answer for you, make sure you send me an email, glutenology@gmail.com, and we'll do our best to create a video answer just for you. Have a great day.